Welcome to Shape of the City, where we cover health and wellness topics relevant to the Lincoln community. I'm Clover Frederick, and I'm your host. Recently, the Partnership for Healthy Lincoln received a $2 million, 3-year competitive grant from the Centers for Disease Control for health initiatives related to Lincoln and Lancaster County. Today, I'm joined by Dr. Bob Rauner with Partnership for Healthy Lincoln and David Humm from the Lincoln-Lancaster County Health Department. Hello, thank you for joining us.
Thanks for having us.
Sure. Well, let's get started. Dr. Bob, will you tell us a little bit about this grant?
Yeah. Well, first of all, it's a grant that had to be a partnership of multiple groups. It had to be involving multiple sectors, and there's actually 13 other groups that are part of this grant with us. That was actually one of the requirements for the grant. The CDC was a nationwide grant. 39 were awarded. A couple things that it had to have. One is you had to have some existing efforts that were already in place, and this group of folks has been working together for several years now. And that's one of the reasons we were able to get the grant. We also had to demonstrate that we've done something kind of like this successful previously, and we have in Lincoln Public Schools. And so part of what we're doing is actually expanding the efforts in Lincoln Public Schools that have been working for the last couple of years. Okay.
Well, you mentioned we. Tell us a little bit more about Partnership for Healthy Lincoln.
Okay. Well, we were formed about 4 or 5 years ago. Basically, it was a grant mostly funded by Community Health Endowment, also St. Elizabeth's and the County Medical Society. Basically to bring folks together to reverse obesity and improve fitness. Started mostly with kids in the school system. That was our biggest partnering project we started off with. So Lincoln Public Schools and a couple other groups like Teach a Kid to Fish have been working together with Lincoln Public Schools on their projects for the last 4 or 5 years. Part of the grant, we had to show that we've been successful, and actually Lincoln Public Schools the last 4 years has lowered obesity and improved fitness year after year. And so that was one of the things that made us qualified to apply for the grant, is that we've shown that we could do it once, we could probably do it again. And so what we're going to do is broaden the efforts. Instead of just the schools, it's going to be before the schools, so kids in the preschool and infant age group. So MilkWorks and Community Action Partnership and Teach a Kid to Fish are going to take on that chunk of the grant. In the school age kids, we're going to do things around the schools. So the community learning centers are involved. A lot of the agencies that work with the schools and the after-school programs like the YMCA, Parks and Rec, Malone Center, groups like that will be part of it. And then also neighborhood organizations, so people that work with either ethnicities like El Centro de las Americas or Malone Center, or people that work in the community like Community Crops, for example, will be part of it.
Okay. Tell us why these efforts are so important in our community.
Okay. Well, part of the problem is obesity and fitness is now becoming the #1 cause of preventable death. We've made a lot of success in smoking. Smoking's down from about 50% of the population 30, 40 years ago to less than 20% now. So a lot of good success. So as that's gone down, unfortunately, obesity and fitness have gotten worse, and so that's actually become the major cause of preventable death long term. And so we want to work on efforts that will make a difference in that. The biggest thing is you have to move beyond just education to actually changing how things are done to actually make a big impact. And so in Lincoln Public Schools, they don't just educate kids about what's healthy to eat and being active, they actually change things. So reinstituting a policy for all schools will have recess, limiting some of the junk food fundraisers, improving the lunch program. So you need to know more than just educate, you actually have to change things, and that's what made a difference.
Very good. Let's switch gears a little bit and talk to David. You're with the Lincoln-Lancaster County Health Department. Tell us a little bit about the city agencies that are involved in this grant.
Sure. Well, it's great to have a supportive mayor for a healthy community, and so he does encourage all of the city departments, of course, to be part of that. And actually, with part of the outcome-based budgeting, we have healthy and productive people as one of the indicators. So all city departments, think about this issue in their programming. We have many of the obvious things, of course, the health department, city parks and rec, 10 Health, our very own 10 Health here, of course. So those are the obvious players, but again, all the city departments are part of that. As far as the health department, we try to work with all of the departments and of course community partners, and we're part of Partnership for Healthy Lincoln also. Probably one of the biggest citywide efforts anyway that people may see is 5, 4, 3, 2, 1, go, kind of the countdown message anyway. And again, it's a citywide message. It's a message, not a program. It's just encouraging people to take steps every day. to be healthier, focusing on children and families. A lot of the youth serving and family serving organizations have adopted that message, and we're kind of a technical assistance in implementing that program, or that message anyway, so they can reach more kids and families. As part of that, we have been nationally recognized for the efforts regarding that. Another kind of key part of that is Let's Move Lincoln. The mayor in 2011 signed on to Let's Move Cities, Towns, and Counties, which is part of Michelle Obama's childhood obesity initiative. With that, there's kind of 5 different goal areas that you work towards, mostly focused on physical activity and nutrition. And actually, just recently, Lincoln was recognized. We're just one of 16 cities across the country that have reached gold in all 5 of those areas. There's about 450 or so cities that are part of that initiative, so that's pretty neat to be just one of 16 cities anyway. And then also as part of that, I think Lincoln is nationally recognized for its parks and trails and kind of the network that we have to get people moving. And here this past summer, Lincoln was just recognized as a Playful City USA. I think we were one of like 216 cities this year to be recognized as emphasizing play. And again, that was geared towards the programs we have available through Parks and Rec and the Health Department in promoting play as an important part of our community. So,
very good. Well, of course, we'll be doing updates here since it's a 3-year grant. We'll be doing updates here for the community, but what are maybe some of the first things we're going to see as part of this grant?
Well, part of it also, we talked about, the schools, the nonprofit sector. The city has 3 agencies, the Parks and Rec, Channel 10 Health, and the Health Department involved, but actually the grant had you to go to other sectors too, so the business sector is going to be involved. WorkWell is one of the agencies that will be working with us. They do employee wellness because if you're going to reach the whole family, you get the kids at school, you get the parents at work. Mm-hmm. They also ask that you reach out to the faith-based sector. So we actually have Salvation Army as one of our first groups we're bringing in from the faith-based organizations. We're going to start working with some churches, especially in the central Lincoln area. Part of the grant, you had to focus a little more on places where the need was greatest. And so there's a section of town where there's 8 elementary schools where the kids are more than 85% free reduced cost lunch, so very low income neighborhoods who have to focus a little bit more there.
Okay.
So you'll see some more, as those efforts roll out, some more detail on those.
Okay, very good. Well, we look forward to seeing how this grant progresses. Thank you very much for joining me today. Sure. When we come back, we'll look at a very important movement happening right here in the community.
My name is Rebecca, and I'm from Lincoln, Nebraska. I believe healthy living starts with each of us. But building a healthy community takes a team of individuals and organizations.
Welcome to Lincoln, Nebraska.
I'm proud to be part of a community where healthy living is a priority.
Welcome back. I'm Clover Frederick, your host for Shape of the City. Today we're going to be talking about breastfeeding, which is an important topic to talk about when we're talking about the health of our community. I'm joined by Ann Seacrest, founder of MilkWorks, and Dr. Kay Anderson, who's with the Lincoln Pediatric Group. We're going to be talking about the Lincoln Community Breastfeeding Initiative. Ann, can you tell us a little bit more about the initiative?
The initiative is a coalition of both Lincoln hospitals, Lincoln physicians, Lincoln medical offices, OB, family practice, and pediatric providers, lactation consultants, WIC, and other community groups such as MilkWorks and La Leche League. And its goal is to provide a supportive community environment for breastfeeding mothers in Lincoln.
Great. Now tell me why this group started.
Well, numerous public health and medical experts and organizations have really identified low breastfeeding rates as a major factor in the health of our country as well as our communities. And one of the messages that we kept hearing from women is that they heard different messages across the community, different messages from different providers, and they really didn't understand how to access help and how to access care from one step to the next. And that there was a lack of continuity of care between providers, and so we decided we needed to fix this.
Okay. Now, Dr. Anderson, you're a breastfeeding medicine specialist and a physician, so tell us more about how physicians have been involved in breastfeeding over the years.
Many years ago, breastfeeding support came mostly from grandmothers. Mothers would help their mothers breastfeed their babies, and breastfeeding was not really a medical issue. So therefore, breastfeeding was not part of the medical education curriculum. So now that mothers know that breastfeeding is best for their babies, they are unable to turn to their mothers for help because they didn't breastfeed themselves. So they're turning to their medical providers. Now, because this hasn't been part of the medical curriculum, perhaps the advice that they're getting isn't consistent amongst the different providers. So this group has come together to try to get those messages more clear and also help educate our providers. Most physicians, I would say all physicians out there, really want to help mothers breastfeed, but since they don't have that educational background, they don't know how to give the advice that most mothers need. So therefore, we want to get people together to do that better.
Okay. So far, how has this initiative been helping?
Well, it's kind of fun. We've looked across the whole spectrum of what happens to moms as they go through the childbirth experience. So we've looked at how can prenatal care providers work with moms, and we've tried to provide them with some messages and some tools that they can help. So we've asked OB providers to have a discussion with moms, to let moms know where they might get support. Both of our Lincoln hospitals have developed a shared hospital policy, so that when a mom goes to one hospital or the other hospital, she's going to kind of hear the same thing about breastfeeding. The policies are going to kind of be the same. We've developed similar curriculum for providers in town that teach about breastfeeding, for lactation consultants that help moms afterwards. So we've tried to just kind of create this consistent message and this system that kind of links together. We're also educating providers on best practices. One of the things that we are really highly encouraging is what's called skin-to-skin care after a baby is born. We know that when a baby spends time on its mother's chest right after birth, for up to about an hour, that this improves the breastfeeding outcome.
Great. What kind of difference do you hope to make in the community?
I would say that overall, we would like breastfeeding to be the norm. So when mothers are pregnant, they learn that breastfeeding is the expected thing that they will do. Now, for some mothers, in the end, it may not work out. but hopefully they will, most of them at least, give it a try. And I think previously the norm has been to feed formula, but I think the tide is shifting over to breastfeeding, and we want to be able to help those mothers do that more successfully.
Great. Now, outside of medical professionals and lactation consultants, how can the community come together to encourage mothers who are breastfeeding their babies?
There have been some really exciting things that have happened in the past couple of years. Nebraska became one of the last 2 states, due to Senator Annette Dubas, to actually pass legislation that really allows mothers the right to breastfeed in a public setting. Wherever they have a legal right to be, they have a legal right to breastfeed their baby. The Affordable Care Act also amended the Fair Labor Standards Act, so employers now need to provide private space as well as breaks for a mother of an infant under a year old to pump while she's back at work. I think there's a whole shift in the community. I really do. I think we see it in that moms are seeing more that this is something that they want to do for their babies. Now, how can they access the support system, since we interrupted that family support system? And we have not been a breastfeeding culture. It's hard to grow up and know how to breastfeed your baby when you don't see it around you. So we're just trying to make that subtle shift to make the whole community be different, including families, friends, co-workers, the work environment, restaurants, public restaurants, in other words, wherever moms are going to be.
Okay. Any words of advice we could give grandparents who perhaps didn't grow up seeing breastfeeding and now they have a new grandbaby and the grandbaby's being breastfed? Any advice for them?
Grandparents are a tremendous support system for young mothers, and I think if they can see that breastfeeding is becoming the norm, even if they didn't do it themselves, they can support the fathers, help take care of the other siblings perhaps, so that the mother can have the time to breastfeed her baby and get the sleep that she needs, and help provide meals and those sorts of things. I think it's also important that we realize the tremendous health benefits, not only for the babies with breastfeeding, but we have to remember there's tremendous health benefits for the mothers also. This grant that we got for Partnership for a Healthier Lincoln, mothers who breastfeed, it helps with rates of obesity for mothers, decreases the incidence of diabetes and heart disease and hypertension.
Well, those are some great benefits for a mom. Now, tell me a little bit more about the benefits that baby will receive.
Well, you know, there's a lot of stories circulating around about what breastfeeding actually does for a baby, and I always like to look at the 2007 meta-analysis that was done of about 9,000 research studies. And that's what we turn to when we look at research-based information on this. And what we know is that when babies are breastfed, particularly if they're exclusively breastfed for 6 months, with breastfeeding to continue for about 12 months, which is what the recommendation is, that what we start to see is we see a decreased lifetime risk of obesity, as well as type 1, type 2 diabetes for babies. We also see fewer acute infections, respiratory infections, ear infections. We also see less asthma and less other atopic diseases that come along with it. So overall, it really widely impacts a baby's health. We're also seeing more and more research emerging on the benefits of the actual process of breastfeeding. In other words, the process of a baby being at the breast, and what this does to kind of organize, mature, and socially develop an infant, because they are part of human beings.
So what information is out there for community members who might want to learn more about this initiative?
HealthyLincoln.org has a link to the Lincoln Community Breastfeeding Initiative information, and on there we have educational tools for prenatal providers and for moms, for support groups after they deliver their baby, and places that they can seek help with breastfeeding. And we hope to add more tools to further educate the public and even physicians to help support mothers breastfeed their baby.
Our whole community benefits when we come together as a community to not only provide mothers and fathers with the type of information they need, but also with this support system that they need. It's a real win-win for all of us in terms of healthcare costs and increased health and well-being for all of our community members.
Okay, very good. I feel like the moral of the story is that there are now a lot of places for women to go to get a consistent message about breastfeeding. So thank you both for joining us. When we get back, we're going to show you some exercises and things you can do in the workplace to break up your day a little bit.
Hi, my name is Tonya Vyhlidal, and I am the director of WorkWell here at the Nebraska Safety Council. WorkWell is a division of the Nebraska Safety Council, and we are a wellness council servicing the state of Nebraska. So we specialize in worksite health, wellness, and health promotion. So today I'm going to talk a little bit about things that you can do to keep yourself healthy and well over the winter months. And we are going to start with some things that you can do to keep your body hydrated and to keep yourself prepared and energized throughout the workday. So we're going to just start here with a great option to coffee. Everybody loves coffee, especially in the winter, even hot chocolate. But this is green tea. It's an excellent source of antioxidants, and it will supplement your water intake. So I highly recommend that you get some of this at your desk, and you can put that in hot water. Secondly, I think everybody should have a blender bottle at their desk so that they can put water in here, and they can do protein shakes and supplement if they want. You can even make fruit smoothies at work and put those in here and drink that throughout the day. And then finally, everybody should have water at their desk. Maybe it's not bottled water, but it's water that's in some kind of glass, and even in your coffee cup. You need 64 ounces a day minimum, and this will keep you healthy and hydrated throughout the winter months. Additionally, the other things that you should make sure you're consistent with, because it's difficult for people to get outside, even during the lunch hour when it's cold out, is a little movement and activity to keep you energized throughout your work day. So I'm going to push myself away from the desk here. I'm going to show you a few exercises, and then we'll go from there. So first we're going to start with sitting upright, fingertips interlaced, reaching up overhead. Lift the rib cage, lift the chin and chest. Good. Now put those fingertips behind the ears, pull those elbows together, opening up the chest and the throat. Relaxing those arms all the way down, relax the shoulders. Shoulder rolls, both shoulders together. And the other direction. A little dynamic warming up here. Now we're going to relax all of that in ear to shoulder, opening up the throat and the side of the neck. If you get headaches or tension headaches, this is a great activity to do for that. Other side. Additionally, people always get low back pain from sitting too much. So we're going to take this leg and cross it over the top of our thigh and reach forward and stretch. And bringing that foot down, doing it the same thing on the other side, pressing forward, relaxing and breathing. And then finally, I'm just going to have you sit with both feet on the floor, kind of readjust yourself, so relax. Take a deep inhale and exhale. Deep inhale and exhale. Thank you. Let's stay healthy together.
How refreshing is 3 donuts? At least 290 calories refreshing, about the same amount in a 20-ounce pop. And you just biked 6 miles to work that off. Don't undo your game. Learn more at healthylincoln.org.
Shape of the City is dedicated to helping Lincoln stay informed of health and wellness topics and events. Visit our calendar at lincoln.ne.gov, keyword 10health. If you'd like to see your event covered, email us at 10healthlincoln@gmail.com. Thanks, and until next time, get active, eat healthy, and stay informed. Check out this and other 10Health TV programs on YouTube. Follow programs and local events on Facebook and Twitter. And don't forget to check out our community calendar at lincoln.ne.gov, keyword 10health.